Welcome to Dateline Schools, a presentation of the St. Clair County Regional Educational Service Agency, with your host, Chris Troy.
High school athletics is one of the most exciting things that students, parents, and in many cases, entire communities look forward to each and every year. But unfortunately, each year throughout the country, student athletes are injured, being forced to seek medical help. Sport injuries is our topic all this week on Dateline Schools with my special guest from the Orthopedic Associates of Port Huron, Dr. Todd Murphy. Dr. Murphy, thanks a lot for being with us this week.
Thanks for having me.
So you have a bit of history, don't you, here in the Port Huron area?
Yeah, I grew up here and went to school here, and now I'm back here practicing.
How long have you been here at Orthopedic Associates?
This is my 14th year.
And do you have a specific, I know you're working on my knee.
Yeah.
Is there something you really lean towards?
I do a lot of sports medicine, so I take care of a lot of kids and adults with sports injuries, but I also do general orthopedics, and I do arthroplasty, so joint replacements as well.
All the way from turf toe all the way to, a bad neck?
Yeah, it encompasses a lot. Yeah, just from minor sprains from falling off a skateboard all the way up to bad knee injuries, bad ligament tears in the knee or in shoulder. So yeah, it encompasses quite a bit. Fracture work too. Occasionally somebody will break something running around.
Now, what are some of the average injuries that you see coming from school athletics?
From a knee injury standpoint, unfortunately we do see quite a few ligament injuries these days. Anterior cruciate ligament is probably the top ligament injury. Sometimes minor sprains, medial collateral ligament sprains. Meniscus tears are much more common in older athletes. And then shoulder type things, we see everything from dislocations to tears in the rotator cuff.
Dr. Murphy, high school sports have a variety from football, basketball, baseball. Do you see specific injuries associated with a specific sport?
Absolutely. For example, a hockey player, the most common hockey injury I see by far is an acromioclavicular joint sprain, so that's a sprain on the top of the shoulder. Soccer players, especially in my female patients, those are non-contact type ACL injuries would be the most common thing I see from those. Football players, they run a lot of gamut, depending from fractures sometimes to bad knee ligament injuries, unfortunately sometimes a neck injury or a back injury as well.
If I'm a parent or an athlete, when should I think about reaching out to an orthopedic doctor as opposed to just maybe putting ice on it or seeing if it gets better?
Sometimes that can be really obvious. There was an event, an injury that happened. The athlete may have felt a pop in the knee. Swelling is a big one. If a joint is swollen, in general, they should, especially in a younger athlete, they should be evaluated. My older athletes, a lot of times they can be just from starting a new exercise regimen, get a sore shoulder. Sometimes that can just be cross-training around it. Those aren't as emergent. Certainly it's okay to watch those for a little while, see if the inflammation tends to go down over time. So yeah, a lot of times it can be very obvious where something specific happened and there's a deformity or a swollen joint versus things that nothing specifically happened and it just kind of gradually came on over time. Those are usually the ones that can be watched for a little bit.
Dr. Murphy, can you give me a little bit of the background on Orthopedic Associates?
Well, we've been around a long time, so it was started by three of my senior partners. They're all retired now, but back in 1983. But the office has grown from there. Our new facility that has been here, which predates me coming back to town, is a nice facility where we have physical therapy, we have an MRI center, we have a surgery center attached to the building as well. So it's become very all-encompassing for musculoskeletal care.
Just how many doctors are there on staff here at the Orthopedic Associates?
We have 8 at the moment.
And now when you say all-encompassing, so I'm guessing that's full right from the very beginning coming to see you right through surgery?
Yeah, in many cases that's true. So a lot of my younger athletes, when we see them, they'll come in to be evaluated. We get X-rays. If an MRI is necessary, we'll order that. And then if unfortunately for them, if surgery is the case, then usually that can be done at the surgery center here as an outpatient for most of those patients.
Now, our main topic this week is injuries in high school athletes. Does the state reach out to orthopedic doctors as yourself to ask for advice on possibly could make equipment safer?
Oh, sure. I think the Michigan High School Athletics Association, they do a nice job. I'm not one of the physicians that they consult, but they certainly do consult physicians with regards to concussion safety, to athletic surfaces, the safety of those, to rule changes even.
Now, Dr. Murphy, looking back a little bit into your past, you played some football, you played some high school sports. Tell me a little bit about that.
I did. I played football at Port Huron Northern. I played hockey and baseball there as well. And then I played in college at a small college called Albion. I played football and baseball there. So yeah, I've had my share of sports injuries as well.
Well, I guess that's my next question. Were you ever injured to the point where you had to see someone such as yourself?
Oh yeah, definitely. That's probably why I do what I do. When I was in high school, I had some shoulder injuries that both of them required surgery. It was done by one of the founding partners at our office, Dr. Shire.
So that's what kind of drew you into orthopedic.
If I was to look back on it, that's likely why I do what I do. I've been on the other side. I kind of know. I know what the kids are going through mentally when they get injured.
Are there specific injuries depending on specific sports? Say, like, do you see more leg injuries during basketball season because of the harder surface?
Sure. Definitely more lower extremity injuries in soccer and basketball, for example. Hockey is very rare to see lower extremity injuries, but they do happen because they're not the players aren't planted to the surface. So that is a little less taxing on their knees versus a soccer player playing with cleats on an artificial surface. There's a lot of grip, and the knee is seeing a lot more force.
No one wants to think about not being able to finish out your season, but I'm sure you've seen injuries where you've had to say to a student athlete, you're done for the season. How is that?
That's a tough deal. Like I said, I've been on the other side of that personally. But I think that I enjoy the relationship at that point because we kind of are in it together to get them back for their next season. So it's a big blow at first. A lot of times there's tears. I'm sure I shed some tears too when I was told that I couldn't finish out a season. But I think from there both me and my patients are motivated to get back from there.
Dr. Murphy, I want to thank you again for being with us all this week. And we've talked about injuries and we've talked about procedures. The thing we haven't talked about is prevention. What are some of the things that a student athlete can do to keep from having to come see you?
That's a real hot topic in sports medicine right now. We're seeing a lot of overuse injuries from kids specializing just in one sport. So one thing that we recommend, especially from the sports medicine associations, are really playing multiple sports, not just focusing in on one sport. We see this a lot with throwing athletes, that they're throwing year-round now instead of just during season, and we see a lot of elbow and shoulder problems because of that. We also see a lot of knee issues from overuse type injuries where they're playing on much grippier surfaces now, a lot more force going through the knee, and without the neuromuscular type training that they need to protect their knee from these ligament injuries.
I'm guessing that the whole orthopedic practice has really changed a lot since you originally used to suit up and play game.
It hasn't and it hasn't. In many ways it's similar, and certainly the technology and how we treat the injuries is a lot more advanced than it was then. I always say we stand on the shoulders of those that come before us. Certainly a lot more awareness over how these injuries happen, much more emphasis on prevention and things of that nature.
Has technology really changed a lot via robots? That was something that probably wasn't around 10 years ago or so.
That for sure was not around 10 years ago. There's always advancements. Everybody's always working on new techniques. Certainly everything's less invasive than it used to be, but the principles of healing are still the same. But yeah, the robotic technology, things that are being done arthroscopically now that were always done with an open incision in the past. So in that regard, things are much different.
Well, thank you again for joining with us this week, and thank you for your team for doing such an amazing job. For Dateline Schools, I'm Chris Troy. Dateline Schools is a presentation of St. Clair County RESA.